Well, thank you, Ken, for the invitation. I'm glad to be here, the first time at LSE. I'll be talking on behalf of our research group, and as Ken mentioned, Berenice and Michelle are here, so for the Q&A, they'll be able to participate as well. So I'll be talking about nutrition governance in Mexico, and I'll start by saying that we have no conflict of interest, and this project was funded by UNICEF. So first to start, kind of like the epidemiologic landscape of Mexico and how much progress has Mexico made in improving nutrition in Mexico. So in terms of children nutrition, Mexico has been able to reduce the prevalence of stunting and wasting as well. But we see that since 2006, there's been, and we're using the National Health and Nutrition Survey, so we don't have it for some years before, but since 2006 we see slight increase in overweight and obesity for children between 5 and 11 years old. So we, for those who are not familiar with nutrition and the nutrition kind of paradigm shifts, we are now talking about the burden of malnutrition, and it's a triple burden of malnutrition because we see at the same time in countries undernutrition, micronutrient deficiencies, and overweight and obesity, and which are not mutually exclusive. And regarding the last one, it's becoming a major problem in Mexico for several decades now, and we see that among adolescents, obesity and overweight is almost 40%, and for adults is almost more than 70% now. And this is a huge public health problem, and it's a widespread problem. Here we see that states in the north, but also in the south, have like the highest prevalences of, and this is only obesity. And even the green and blue colors, this is 30% prevalence of obesity. So we see this just basically anywhere between 30 and 54% of prevalence of obesity in Mexico. And I mean, it's everywhere. So this talks about the scale of the problem and that it's really a multi-causal problem. And it has to do with socioeconomic inequality, and that's a trend that, I mean, at least for example in the UK we've seen. In Mexico we are starting to see that it has roots in socioeconomic inequality. And we can see here among the low-income communities, obesity is increasing. Overweight is kind of decreasing a little bit, but we see obesity increase. In the middle-income communities, we see both overweight and obesity increase. And now we're seeing among the high-income communities, both overweight and obesity declining. So what we've seen from other countries like the US and the UK, this is just going to continue. And of course, this is important in the context of high prevalence of diet-related diseases like obesity, like diabetes and hypertension. Here are a few numbers. So just those with prior diagnosis of diabetes is 13%, and those with prior diagnosis of hypertension is 30%. So this is quite high, and of course causes a lot of suffering for people, but also costs to the health system. And then again, in the context of food insecurity and water insecurity, which is also becoming worse given the climate crisis. In Mexico, there's like 60% of households living food insecurity, and these can be mild, moderate, or severe, and also water insecurity. So what we see is a very complex picture, and our understanding of nutrition, its causes, and the policy responses has shifted. So what have been some of the policy responses to these problems? And so in nutrition, we recognize kind of this paradigm shift between a focus on undernutrition to a focus on triple burden of nutrition. And what we're trying to do is mapping then the policy responses under each paradigm. And this is kind of work that we want to do. We're preparing for this presentation, and then we started discussing about this. But this is kind of like preliminary how we're like classifying the policy responses. So under this paradigm of undernutrition and poverty, the causes that were discussed kind of in the public arena were, well, there's not enough food. That was a problem, right? So then the policy responses are subsidies for food production, but subsidies also for consumption. We see national food programs, we see cash transfers that have strings attached, so they give a certain amount of money to families, and in exchange to go into the health centers and monitoring their height and weight, etc. And then we put this transition period because there was this transition where kind of the health system approach was the dominant approach, and kind of this health services responses to undernutrition was important, but also to the triple burden of malnutrition. And one of the most recent strategies was the diabetes and obesity strategy that was implemented by the previous administration. But it's a strong focus on the health system response, and it's about interventions within health services, so it doesn't really take a systemic approach. And now under this kind of paradigm of like triple burden of nutrition, I think we have a more complex and nuanced understanding of the causes of malnutrition, which includes quality of food, not only quantity, includes the commercial interest as drivers of malnutrition in the country, and there's kind of this wide acknowledgement that food systems are broken. And so some of the policy responses, and the most recent policy responses, have been really focused on regulation. So, for example, the front of package labeling, school environment regulations, tax on sugar drinks, but also, and aligned with kind of the ideology of the current administration, is this focus on food security and food sovereignty. And also we see kind of the early steps to bring together the agriculture sector with the health sector. So this has, the policy responses have very sectoral, so each sector responding from their own perspective, but at least we see under this administration a small attempt at bringing together agriculture and health, for example. And then we also see the new dietary guidelines that emerged in this administration that are good for the people and for the planet, so then this dimension of sustainability emerges within this paradigm. So there has been important regulatory progress, but food policies and nutrition policies are still very fragmented. There's no integral strategy to address nutrition from a systems perspective. So the right to food is in the Mexican Constitution. This year, the law of adequate and sustainable nutrition was passed, and this was a very important step and a major success of civil society and social movements. Mexico has enacted these regulations, but still there's fragmentation. And that's really not helping a sociological perspective to solve the problem. So at least now there's an understanding that to solve the malnutrition problem, we need to intervene at different levels. So not only at the individual level, but at the interpersonal, so household level, organizational level, at the community, both rural and urban, and at the policy level. But so what kind of mechanisms do we need to then design, implement, and evaluate policies that intervene at these different levels? I'll skip this one for now. And that's why governance becomes an important issue. And governance defined as the ability of institutions and other structures to uphold the principles of participation, responsiveness, and accountability in the realization of the right to food. And that governance needs to include the capacity to act, the power to act, and the commitment to act. And again, it requires accountability, responsiveness, and transparency. And so this is all to kind of justify our motivation for this study and to give you a background. So our objective was to analyze and learn from the implementation of two governance mechanisms that were implemented. One in 2012, so not, and this was at the state level, at the national level, and one at the federal level, and this was implemented under this administration. So this is kind of a recent governance mechanism. And it was the first attempt to bring together different sectors under a group, and I'll talk a little bit more about it, but it was basically the Ministry of Health, the Ministry of Agriculture, the Ministry of the Environment, and the Economy Ministry. So what we did was we took an implementation research framework. So this is a framework that is used to assess implementation of health interventions mainly. So we had to adapt it because we were looking at a governance mechanism, which is not exactly a health intervention. So it has 5 dimensions, so 5 domains, starting with kind of the context of the intervention, in this case the governance mechanisms, the inner setting, which is the setting where this mechanism is being implemented, and this was the hardest domain to adapt because a governance mechanism is a bit like abstract, so it's not like you're implementing an intervention in a hospital setting, so the hospital setting would be the inner setting, but in this case it was the relationships between or among the ministries that was like defined as the inner setting. Then the innovation setting means the characteristics of the mechanism, of the governance mechanism. And for this, we did an additional literature review to look at nutrition governance and food systems governance and identify constructs about good governance that we wanted to include here in the design of the mechanism. So we wanted to compare the governance mechanisms design to the ideal design of governance mechanisms. And then individuals who are involved in implementation, so we also look at the characteristics, and then processes of implementation. And we'll focus on that, on those constructs, so which are about to what extent the team implementing these governance mechanisms assesses the needs of the people, assesses the context, plans, engages with stakeholders, etc. So what we did, we designed a qualitative study. We conducted key informant interviews with 25 stakeholders, and we did a document review. And we used this framework about stakeholders involved in health policy implementation to just map the stakeholders that we had and be conscious of who we were leaving out or not. So we ended up interviewing mostly bureaucrats, so civil servants who were directly involved in the implementation of these governance mechanisms. We interviewed interest groups, and we put within interest groups academics, and then one political leader, 2 donors, so from like international organizations. We couldn't at the end interview financial decision makers, and it's a major limitation of this study because, as we will see, the budget and the budget was a key missing piece in both governance mechanisms. And we also didn't interview beneficiaries. In this case, I mean, the beneficiaries of a good governance mechanism, I mean, it's the population as a whole, so we didn't interview people. So before I present the results, a few the description of the 2 mechanisms. So at the federal level, HISAMAC, which was this group, was a minister-led initiative. So this was ministers coming together at the beginning of the administration saying, let's work together. So it was based on personal relationships. They shared a common vision, so that made it easier. But it was pretty much minister-led initiative. In the case of the State Council in Yucatan in the south of Mexico, it was more of a top-down approach because a law was passed and then, well, the governor had to establish this council. Then in terms of the participation, in both cases we see participation of ministries, of different ministries, of civil society, although it has its limitation. There were civil society groups involved that were kind of traditionally close to the people that were in power, so to the ministers. Then international organizations we see in both cases, and academics. And then the main difference was that the federal group remained an informal mechanism. So it was an informal group. It was like, let's get together. These ministers said, let's do something. They tried to get approval from the president to make it into a more formal group, but this wasn't possible. But the State Council in Yucatan is pretty much a formal mechanism. It's in the law, it has to happen. So that's the main difference between both governance mechanisms. So the purpose was not to evaluate the effectiveness of these governance mechanisms, but we did ask participants about the main successes according to their perspective. So in the case of HISAMAC, what they said is, well, HISAMAC was able to work together and pass the regulation for the front of package labeling. Also, there's been a recent decree on the use of glyphosate and GMO corn, and the dietary guidelines, and the schools for environment regulation. So again, this is not our perspective as researchers. We're just reporting what they said because again, it was not the objective to evaluate the effectiveness, but it gives context to these 2 mechanisms. And then for the State Council, there was this program to improve school food environment that they saw as a major success of the governance mechanism. I think it's a very important research question to what extent these governance mechanisms have been effective or have resulted in effective policies being designed and evaluated, if anyone is looking for a topic to do research on. Okay, so what did we find? In terms of, and I'll only present results of 2 of the 5 domains, so this one about the design of the mechanisms. And although the objective was not to compare both, we thought that a comparison was useful and informative, and then we'll present separate results. So, but in terms of comparing, we found common barriers in both mechanisms. A main one was that they don't have allocated budget. So, I mean, yeah, it's good to bring people to the table, it's good to have good participation, good intentions, but they didn't have real money to do things. So this was a major limitation. The lack of community participation, so both do a good job in engaging different sectors, in engaging civil society, but really engaging with the community was not achieved. They also had very limited transparency mechanisms, and as we saw, one of the key elements of good governance is transparency and access to information and accountability. And both mechanisms were quite weak in this domain. So they didn't have mechanisms to share and be transparent about the processes, like priority setting processes, or just like how did they decide what to focus on, but also like in how they were measuring progress in improving nutrition. And so that led to weak accountability mechanisms. They were really not functioning as accountability mechanisms. And they also both had problems in translating a systemic approach into multi-sectoral sections. So we do see a shift in narrative. So both governance mechanisms acknowledge that it's a systemic problem, that we need different sectors. So in terms of discourse, which is important, is there, but they didn't really manage to get different sectors to work together. And we'll see that this is related to some of the barriers we saw in the implementation processes. And some common facilitators was that they're not easy to achieve, were participation from various ministries, so it's a facilitator, and then civil society participation, that there was participation from different organized groups of society. And then in terms of the processes of implementation, so we're looking at issues like collaborative work, like their capacity to plan, their capacity to execute, etc. We see common barriers. The fact that the participation of the members was voluntary and there were no formal incentives, that was a major limitation. So it was based on good intentions, and that can only go so far. Another one was that there was no systematic collection of information about priorities, preferences, and needs of people. And as you remember, again, one of the main or key elements of governance is responsiveness, right? To what extent the mechanism is able to respond to the needs and the preferences of the people. So we did not see evidence that this was happening or that it was happening systematically. It may be because they were, I mean, at least Kisamak was a fairly immature group, so it was like forming, and it never really got to a mature stage. And this is what some of the participants or key informants reported. And then lack of implementation in small steps. So kind of in good practices of implementation is about implementing in small steps, learning, cycles of change and improvement. And we didn't see a strategy of, okay, what are we going to achieve first? What is going to be the first quick win that we're going to focus on? And then we're going to build momentum, and then what's going to be the next one? And again, in bringing so many different sectors to the table and identifying common interest, I mean, that's hard, but we didn't see a lot of that thinking behind or that execution. They both had trouble engaging political leaders. So in this case, the president and the governor. The president lost interest in Kisamak after a while, and that's what informants report. At the beginning, there was a lot of support, but they were not able to sustain the support and translate it into kind of a formal authorization to make this mechanism something much more formal. And then we saw also limited reflection and discussion about the success of implementation. So again, a good practice of implementation is to come together regularly and assess whether you're on track or not to meet, meet your objective. And in this case, it happened a bit informally, but we don't see evidence of systems to come together and discuss whether they were on track or not. And then common facilitators were collaborative work at the technical level, so we did see that. So key informants report that technical experts and people really came together to work, and this was really, I think, an important achievement, an important facilitator of these governance mechanisms, both in HISAMAC and at the state level. Although at the state level, health and the nutrition field kind of dominated the council, and there's a need to have more multidisciplinary work. But in HISAMAC, you really had like people from agriculture, people from the environment, people from health, really coming together in working groups, producing recommendations. Now, the problem was that they were not able to move those recommendations because they lack political commitment. And then engagement of stakeholders, it was a common facilitator in both mechanisms. So some policy implications for the future. At the state level, so we divided them into continue doing, so you did well, continue doing that, and then need to do. So they need to continue doing strategic planning. So at the state level, there is planning. They have regular meetings. They need to have a proper plan with objectives, etc. And they have good multi-sectoral participation. However, they need to strengthen the systematic view of the problem and the multidisciplinary work. They have mainly nutritionists working in the state council, and that kind of limits the work that they can do to bring different sectors together. They also need to manage and prevent conflicts of interest and kind of rethink the private sector participation. So the private industry does have a seat in the council. And even though they cannot vote, they are a presence there, and we all know there's like asymmetry of power between government and the private industry. So this is something that the state council needs to have. They need to have a system to prevent conflict of interest and to manage on equal terms the participation of private sector if that's what they want. They need to guarantee allocated budget and establish formal incentives. And they need to ensure the participation of the community. And this is a field that I think it's hard to identify what works in engaging the community. I think this is like an area where perhaps researchers and communities can come together to develop good mechanisms for their participation, that communities feel like they are legitimate mechanisms and they are really being able to voice their preferences and needs. And then a very important one, improve transparency and accountability, because if not, it's not really a good governance mechanism. And at the federal level, so they need to continue promoting the systemic view, which they have. I mean, and this is really for the first time that in the public discourse is acknowledged the need to have like a systems perspective to this problem, and that was very important. Multi-sectoral participation as well. They need to continue engaging with different sectors. But what they need to do is they need to establish a formal structure. So they didn't manage that. Now there's a huge opportunity because with the law that was approved, now it's in the law that there needs to be a system for bringing all these sectors together. So hopefully that will be kind of the way to really have a formal mechanism, governance mechanism. They really need to do strategic planning and think critically about what are the objectives that this group needs to have. I mean, again, it's very hard, and we have quotes from key informants saying, well, you know, the president tells me to do this because I'm the agriculture vice minister, and that's what I'm going to do. Why should I do something else, right? Like, so the incentives are not aligned. So having a strategic vision of what are the things that can bring the sectors together that are kind of like win-win for everyone, and then from there to build momentum and then tackle the kind of bigger reforms that are needed. And one of the reforms that emerged in the interviews was kind of like school meals, like universal school meals that are nutritious, etc., where that would imply the education sector working with the health sector, with the social protection system. But different key informants mentioned that as like perhaps that could be like one first objective of this multi-sectoral group. Improve transparency and accountability as well. which goes hand in hand with strengthening monitoring. Another part of this project was to look at the state of implementation of actions to improve nutrition, and what we realized is that we have very little data. We have very imprecise indicators or bad quality indicators, and for some other areas, like to what extent are we changing the food environment, there's really very little data. And then systematically collecting information about priorities, preferences, and needs of the people to be truly a responsive mechanism. So yeah, just to end, I think Mexico is in a good position with the recent law. There is a real opportunity to strengthen nutrition governance in Mexico, and I think we as academics and researchers need to be there trying to support and trying to make sure that now the new design of this system takes into account the evidence of good governance and that this leads to something good. Yeah, so thank you.